kicked off the record. And just for those of you that are coming in the chat, we've put the link if you want to submit your CEUs, and there's a disclaimer on the presentation. Can you see my screen? You guys can see it, right?
Yep.
Okay. And we'll leave that up there until we do your intro, Dr. Mike.
All right, I'm gonna go ahead and get started because this is the top of the hour. And of course, our next speaker really truly needs no introduction. It's Dr. Mike. Dr. Mike has had a long-standing interest in the psychosocial impact of pediatric cancer and its treatment on patients and their families. He has been extensively involved with Camp COCA-I, a program of peer support, respite, mentoring, and recreation for children with cancer and their families, centered on a residential camping experience. He served as medical director and a member of the board of directors for COCA-I for many years. He has conducted research into the impact of camping and peer support programs on pediatric cancer patients, as well as their siblings, with COCA-I and also the Children's Oncology Camping Association International, COCA. He was a member of the board of directors and the research and education committee of COCA for many years, and served as president of COCA from 2016 to 2018. He previously served as a member of the American Cancer Society's peer review committee on psychosocial and behavioral research, and serves as a volunteer visitor for the American Camping Association Accreditation Program and for the COCA Gold Ribbon Program. Thank you, Dr. Mike, for joining us today. And when you are ready, the floor is yours.
All right, well, I'm ready anytime. Let's see if I can share my screen successfully.
And I just stopped sharing, so you should be able to do it from there.
All right, let's get into the right mode here. Okay, so this is just some of those things that you already said, so there's no need to go over that again. So let's just get started. And I want to make this as much as possible an interactive session. So you can drop questions in the chat. You can raise your hand or something with the little buttons at the bottom of your screen, so that we can talk about things that come up. If you have a question about something that I've said or a story that you'd like to share, I think that's fine. We want to all be a part of what's happening. And the flow will be better if everybody is more engaged. So the most important message, I think, is that obviously medication management is important for any children's camp setting, but in the work that we do, even more important, because many more of our campers are going to be on medications, and the medications that they're going to be on are going to be ones that you want to be even more careful to keep out of the wrong hands. But obviously, in any setting where you've got children, these days, more and more kids are on different kinds of medicines for different reasons. And it's really important to make sure that they only go to the kids for whom they are intended, and that they're not accessible to anybody else who might get into trouble by accessing them. And it's also important to make sure that they do get to the kids that they are intended for at the right time and in the right manner, so that they gain the benefit from them. There are a lot of things that go into sort of the planning process and execution of a medication management system at a camp. And many of them are different from one camp to another. And so there's no one sort of size fits all solution. And you need to think about your own individual situation while you're designing it, on top of the sort of the regulatory issues and the logistical issues and the medical issues. You have to kind of come up with solutions to some of those problems that are unique potentially to your own to your own site. Some of the things that you need to think about from the regulatory standpoint, there are multi-levels of laws and regulations that you need to be aware of and comply with. And at the federal level is where drugs are regulated overall. The state is primarily responsible for regulating the practice of medicine, so who can do what and under what circumstances, depending on their licensing authority. And then at the local level as well, your local health department likely has some codes and regulations that pertain to how organized camps need to operate in their jurisdiction, and they will talk about their own perspectives on the medication management issues. You want to obviously be very much focused on who are your campers and what are their medication needs. I think the professional camp standards from the ACA, the Canadian Camping Association, and COCA, COCA's goal driven as well, are important things, and we'll talk more about that later. And then there are things that are purely logistical. How is your camp laid out physically? How are facilities, related to each other in terms of physical space? Are they right next to each other? Are they a long way away? Are there barriers in between? What are the things that you need to think about in terms of making the process efficient and minimizing errors as a consequence of that? And then who are you going to be working with? What staff do you have? Who's going to be helping you? What is the role of different people going to be? And that includes both medical staff and camp staff who will be responsible for the kids and bringing them back and forth to get their meds, or in some situations, some of those staff will actually be giving medications. And there are other things as well that might be unique to individual situations. And always you should think about it from the context that the bottom line is that you want the environment that your campers are in to be as safe as it possibly can be, and for your staff as well. So a good place to start, perhaps, if we're going to talk about medication management, is what is a medication? And camps might define that a little bit differently. There are legal and regulatory definitions of what those things mean, but sometimes what we need to do to keep our population safe might be a little bit broader. So drugs, we talked about, are regulated at the federal level, both in the United States and in Canada. And a drug is any substance that has some kind of biologic or physiologic effect on the body or a part of the body. A medication is different from a drug. And all drugs are not medications. All medications are drugs. So a medication is a drug, but one which has a beneficial therapeutic effect in the treatment of some health condition. So if you used that narrow definition of medication when you were thinking about drugs, then there might be other things that people would bring with them that wouldn't be on your list. So you need to be aware of things that are drugs but that are not medications in your overall camp policy, obviously. But then there's another breakdown. There are prescription drugs, which can only be accessed by visiting a medical professional and having an order written to obtain those. And then there are the drugs that we call over-the-counter drugs. You can go into Walgreens or CVS or whatever and buy Tylenol and Advil and all kinds of allergy medicines and different kinds of things. They don't require a prescription of a medical professional, but they are, sort of licensed for certain indications. And so there's a package insert that comes with all of those that says what they can be used for and what they shouldn't be used for. And then there are other things that in the United States we call dietary supplements and foods, and in Canada are called natural health products. And they're not defined as medications, but they still potentially can present risks to the consumers, and kids with health needs are possibly at greater risk than other people for some of those things. And it's a really broad list of things, including vitamins, minerals, homeopathic medicines, herbal remedies, traditional medicines, amino acid products, probiotics, fatty acid products, enzymes, supplements, different kinds of things that are out there that different companies market to different audiences for different reasons. The way that group of things is regulated in the United States and in Canada is very different. And I happen to think that the Canadians do a much better job of dealing with it than we do in this country. In the United States, essentially, a company can market anything that they call a food or a dietary supplement. And there's no control over that. Only if somebody gets into trouble when they use it, does it come back to be tested to see if it's safe. So if I put something out on the table and say, this is a food, I want to charge you 25 cents to take one of those, I could put anything out there, and there's no way that you would know exactly what I was putting out there. If you took it and got sick, then I could get in trouble, but it's a retrospective kind of view of things. In Canada, they look at these sort of what they call natural health products in a different way, and it's much more similar to the way in this country we look at over-the-counter medicines. So you need to show that they are safe before you can just put them in the store. And in this country, you don't. So we need to be a little bit more sort of self-protective. You need to have your defenses up a little bit, and don't just assume that anything that you can buy that is in the store that somebody says is a good thing necessarily is. And then there also are a whole wide variety of different ways that these products are sold, and the way the story is told in the public sector, in, you know, on social media, in conversations, in, you know, oral presentations. There are regulations in this country. You can't label a food product with something that is claiming a health benefit unless you've proven that. So the FDA does regulate labeling of those kinds of things, but there are a lot of things that are not labeled as a medical benefit item, but that people sell them, and there's definitely a sub rosa sort of message that they want you to get, which is, this is going to be good for your health for this or that reason. And so it's, you know, you never know what might be in that backpack that somebody brings and says, you know, these are my foods and snacks. And I think that, as, you know, again, especially since we're dealing with vulnerable kids who are on other medicines that might make them more susceptible to different kinds of side effects that some of these substances may have, we need to be sure, I think, that we're controlling all of that stuff, and not just saying we're only going to worry about drugs and medicines as they're defined legally. And if you bring any of the rest of the stuff, you can do whatever you want with it. I don't think that would be responsible. So let's talk a little bit about the different types of medicines and how they're controlled. So I mentioned already that prescription drugs can only be obtained on the order of a physician, or in some jurisdictions, advanced practitioners like physicians, assistants, or nurse practitioners have prescriptive authority, and they can also write prescriptions for drugs. They need to be, the prescriptions are written for use by a specific person at a specific dose in a specific way. And so they're limited just to one specific indication and one specific camper. In some jurisdictions, it's possible that you can make drugs available for use by the camp. And the things that are most commonly people are looking for in this category are things like EpiPens or asthma inhalers that you want to have available in case someone comes to your camp and they have an allergy which they weren't aware of or didn't disclose or didn't bring their EpiPen, and they get stung by a bee, or, you know, whatever it is that's going to set them off some food substance that they encounter. If you don't have that EpiPen immediately available, that can cause big time trouble really quickly. So if you are in a jurisdiction where you can have some things sitting on the shelf that were prescribed for use at Camp XYZ under these circumstances, that's great. In some states, the regulations are written in a way that make that really difficult to do, that pharmacies can't dispense something unless it's prescribed for a specific patient. And so the variety of ways that people get around that, but it's much easier in the jurisdictions where you can actually have someone write a prescription for a supply of those kinds of things to be made available to the camp for use in those defined circumstances. Over-the-counter medicines, on the contrary, anybody can get them. You can walk into whatever your local drugstore is and buy whatever you want, but there still are controls over how you can use that if you're giving it to somebody else. You can buy something for your own use and use it, you know, as you see fit, that's fine. But to give that kind of medication to, especially a child, who can't make that decision for themselves, you need to be sure that you're doing that in a way that will comply with the law and with the regulations. So in order for that to occur, that still means that you have to go back to that, what I was talking before, that prescriptive authority. So you need to have either a doctor or a PA or a nurse practitioner who has prescriptive authority to tell you, if you are a nurse or someone else on a camp staff, please give 2 325 milligram Tylenol pills to Johnny because he has a headache and I think that will be good for him. Then you can go ahead and do that. Or the other thing that makes life much easier in the camp setting is if you have a written procedure for what to do in the case of common kinds of things that happen at camp. So if you have a headache, then think about this, and in these circumstances you can give this. Or if you have a stomach ache, think about these things, in these circumstances you can give that. If you have a rash, then if it looks like this, you can use this cream, and if it looks like that, you can use this antihistamine. So if you have specific guidelines that are written that give your camp nurse a written policy, then those over-the-counter medicines can be given to those kids, assuming you have the permission of the parents to give them. And that obviously is something that you always need to do when you are taking care of kids in a setting where their parent or guardian is not present. And then you also need to have a record-keeping system. And that comes in many shapes and sizes as well. It wasn't that long ago, from my perspective, that a lot of us just had pieces of paper that we scribbled down what we gave, and then we stuck it in a big envelope at the end of the week and put it away in a storage bin for a long time. That isn't a very good way to do it, because it makes it really hard to get anything out of that if you need to look at it for some reason later. And the reason you have to keep those records is because if an issue comes up about whether someone maybe got the wrong medication or the wrong dose or didn't get something that they were supposed to get and something bad happened as a consequence, you need to be able to go back and show exactly, this is what happened, this is what time it happened, this is who did it, here is our record of it, here's the signature that proves that that was done. So there now are several different online medication management systems that will keep all those records for you if your camp has sufficient internet capacity that it takes less than an hour and 20 minutes for it to come up on your computer screen. But written records are still acceptable, but they need to be organized in a way that you can find what you need. And that third component of things, the dietary supplements and other natural health products, often present challenges for a variety of different reasons. If a parent sends their child up to camp with a big bag full of brown, green, and blue pills that they want you to give, and they give you a very careful description of what they want you to give and when they want you to give it, if you are the camp nurse who's presented with that, that might still make you feel really uncomfortable. If you don't really know what it is, or you don't know what it does, or you may know what it is and you might be uncomfortable with what it might do. And so you need to have some kind of system in place for how you're going to deal with that situation. And there are a variety of ways of doing that. One of the things that some camps do is say, vitamin supplements, dietary supplements, things like that, unless we have a written doctor's description of what you are getting and why you are getting, and a specific instructions for how to give it, that we as nurses are not going to give it, because that puts us in a situation where we're accepting some liability for something and we don't really know what it's all about. And a lot of those things, if you miss a week out of a 52-week year, it's no big deal. If they're just being given for health supplementation, if the parents think they have some therapeutic impact on their cancer, which often they do, they're going to be more sticky about wanting to be sure that it happens. And in those kinds of circumstances, again, depending upon the age and the capacity of the child, you could tell the parent that you will keep that product in the health center, but the child needs to come and ask for it. And under someone's watchful eye, they need to take it by themselves. We're not going to give it to them because we're not sure what it is and we're not sure what it might do. So those kinds of things also you need to think about. And then obviously, even things that are, relatively well accepted and not perceived as danger. If somebody's taking a multivitamin tablet every day, that's no big deal. But if you've got a big bottle of multivitamin tablets and someone else gets into it and drinks half of them, that can be a bad thing. So even though that's not a drug or a medication, it should still be kept in your health center, and it should be controlled and locked up when there's nobody there to watch it, so that no one else can have access to it and get themselves into trouble. And again, that's even more important in our more sensitive population of kids. I mentioned already that in Canada, they regulate those over-the-counter drugs and natural health products in a very similar kind of a way that makes it easier to determine what they are and what they, what the specifics of what they contain might be, and they've verified that they are safe before they just make them available for general sale. But I strongly feel that all of those different types of things need to be considered in the medication management plan to ensure that everybody stays safe. The regulatory framework I mentioned a little bit as well, and just to elaborate a little bit, prescription drugs and over-the-counter drugs are regulated at the federal level, both in the US and Canada, and there are very specific rules about what substances can be given in what doses and by what routes and taken by whom for what indications. And the medical professionals who are going to be working in your camps all are going to be working within that system. And the one thing that is most different from camp to camp is that the licensing authority is regulated at the state or the provincial level. And so it varies from state to state what nurses are allowed to do, what pharmacists and pharmacy techs are allowed to do. And so you need to be careful that you've looked at the regulations in your own, in the legal jurisdiction where the camp exists. Not necessarily, if you work at a hospital in Detroit in Michigan, but your camp happens to be in Wisconsin, then you need to make sure that you're abiding by the laws in the state of Wisconsin when you're deciding who's going to give medicines and how they're going to decide how to make that work. One of the differences that in some locales, these advanced practice people like nurse practitioners can actually prescribe medications, and in other jurisdictions they cannot. They can only follow a doctor's prescription, and the pharmacy rules are different as well. Pharmacists are always the ones who are can identify medicines and can package them and label them. And that's a really helpful thing to have at your camp if you have access to that sometimes, because we've all seen parents who've tried to send their kids up with a big bag full of pills, or maybe one of those pill boxes where they're all divided by day. But, if you were giving those to somebody, you need to be able to verify as a nurse or whoever is dispensing the drug that it is what they said it was, and that it's the right dose level, the right size pill, and all of that. And that generally isn't something that most doctors and nurses can readily do. So if you get that kind of a situation and had a pharmacist there, they could repackage and relabel all of that and make it worthwhile. Otherwise, you got to send them all back. And you should always ask your parents to send the medications in their original containers with the label on them, so that you can identify what's in it more accurately. The local health authorities, as I mentioned, also will sometimes have safety protocols and camping regulations that are unique to each individual jurisdiction. So a city's health department or a state's health department or a county's health department, depending upon how the structure is set up in the place where you are, may have either bare minimum sort of things. We need to make sure that your camp has its kitchen inspected, and we'll look for rats around the corner, but that's all we're going to do. But there are some health departments who have a whole set of policies and regulations around organized camping, and send people from the health department to inspect the camp and look at a whole lot of things that might be in the healthcare delivery and medication management arena. So again, if you're not aware of that and somebody knocks on your door and says, we're here to do our health inspection, that could be embarrassing. So look at what the regulatory and legal framework is very carefully in your own jurisdiction. And then the last set of things that it's important to be aware of are the standards and best practices in the camp industry. As I'm sure you're all aware, the American Camp Association, the Canadian Camp Association and its provincial associations, and COCA-I's Gold Ribbon program all have a set of standard best practices that have been designed to serve as guidelines for association members and are also useful for accreditation. And some insurance companies that are active in the camp sector also have their own guidelines and best practices. And so when you're setting things up, you really want to take those things into account. From your insurance company's perspective, if you don't do what they say, they may not cover you in the case of some bad event occurring. So that has an immediate impact. But the other things I think are important to be aware of as well. It's not mandatory that you get any of these accreditations, but there still is a legal implication potentially, which could make a big difference for your individual camp if there was an incident which resulted in the harm of a camper or a staff member. Because if someone is suing you because their child was injured in some way, what the courts look at is sort of what a reasonable person in a similar situation with a similar sort of professional certification should have done as compared to what actually happened. And they often use these generally accepted standards and guidelines from different organizations to help them define what a reasonable person should have known and should have done in a certain circumstance. And so from just a basic civil liability point of view, it can have an impact. If there's a question of criminal negligence, it can have an impact, and professional malpractice as well. You should at least look at and be familiar with those standards, even if you don't seek accreditation from ACA, which many people don't, or from the Gold Ribbon. And all of these organizations have as their reason for promulgating these best practices, they want to help you to keep your program safe. And so they're not designed to be punitive. They're not designed for, sort of the feeling that you sometimes get with a JACO inspection of your hospital, that they're there looking for a problem and they're not going to be happy until they find one. They're supposed to be supportive and interactive and educational and helpful. And the people who are involved in developing and managing those programs are often excellent resources and very willing to talk to you if there's something that you see that you don't understand or that you're not sure how you can do in your particular situation. There's always someone that is going to be more than happy to talk to you about how you could make that work in your own setting. So another thing that you're going to be thinking about is who's there that's doing all of this. So what level of training and licensure do you have present? Do you have a doctor all the time on camp? If you do, then you can always get that person to give that prescription or order for the use of a medication. If you don't, then it really will be helpful to have those standard treatment procedures written and signed by a doctor, so that if someone comes into the health center in the middle of the night with a headache and you think that a little Tylenol or Advil would help them, that you can give that without getting into trouble for it. Whatever your standard, depending upon who your campers are, who your medical staff are, and what level of medical care your facility can support, you may have a very different sort of formulary of what you keep at your camp. And you'll want to have things for the common kinds of camp complaints that any camper might get, whether they are a child with some health problem or any other perfectly healthy child who's just going to camp. And so things like headache, stomachache, vomiting, diarrhea, constipation, dehydration, allergies, fevers, minor injuries, poison oak, sunburn, insect bites, splinters, earaches, scrapes and scratches, swimmer's ear, cough, sore throat, toothache, menstrual cramps. Kids are going to complain about these things wherever they are. And so you want to be prepared to deal with those kinds of issues. Like I said before, if you have somebody who's licensed to prescribe on site, they can direct the use in any situation at any time. The nurses can administer the medications according to any valid prescription or valid standard procedure, but they need to be able to know what it is. So it has to be either in its original container with the prescription label or the OTC labeling information, or if you have a pharmacist or a pharmacy tech, then they can re-identify and relabel medications for your use. Sometimes pharmacists are also allowed to administer medications. They can do that in some states and not in other states. And the last point in your chain sometimes is going to want to be one of the regular camp staff. If you've got a group that's going on a hike in the afternoon and you don't have enough medical staff that you can send someone with them, and you've got somebody who needs to take a specific medication at a specific time, then you can train one of their counselors or another leader in there who's going to be going on the trip for, this is the medicine, this is what it's for, this is when we're giving it, this is how you give it, this is what you should watch out for. And then you can document that you did that training, and then they will come back and tell you, yes, I did give that medicine at that time, and can co-sign your medical record entry. The documentation is still the responsibility of the medical staff, and you can state that it was given by so-and-so who's on the regular camp staff, and that is fine. You need to have a balance between what the needs of your campers are and what the resources are that you have. And I've mentioned several times that some camps have a doctor all the time and some don't, and some have nurses and some have pharmacists. And so that's something that you need to be thinking about. How many campers do you have? How many of them are going to be on meds? How complicated are their medication regimens? Do you give medicines other than oral meds? How many medical staff do you have? What are their credentials? How many of them have pediatric oncology experience? How much space do you have? What equipment and supplies do you have? Where is your health center located relative to other camp areas? One of the, the thing that keeps camp nurses busiest, besides those sort of routine bug bites and scrapes and scratches, is giving regular medications. And usually we try to structure those so that around meal times is when you give as many as you possibly can. Well, if your health center is right next to the dining hall, then that makes it a lot easier for a lot of different reasons. There's one camp that I'm aware of that has their health center is just across the sidewalk, really almost literally from their dining hall, and it's set up so that there is a window that is on the deck that faces the dining hall, and as the kids come up to get in line to enter for the meal, the ones that have meds just walk up onto that porch and they go by the window, and it's like a pass-through window. They don't have any fries that they serve with the meds, but it makes it very easy. The nurses are inside the health center handing out the meds. They have everything all ready. They sign it off on the MAR as they're giving it. The kids walk by and go and get in line with the rest of the group. Everybody is in visual contact with each other from all the individual cabin groups the whole time. And they don't have to schlep everything to a different location in order to pass out those meds. It's rare that is the case. And so very frequently in a camp, one of the COCA camps, that all of the medicines are packed up in some big plastic container and carried over to where the kids are going to be eating. And then that just adds a couple of layers of complexity in making sure that you have everything that you need, making sure that you have all the documentation that you need to actually know who took what. I remember one camp that I visited once where they brought all of the kids' meds in the bag that they stored them in with the kid's name on it and set them all on a table. And then each of the campers would come up and take the bag and take their meds, and they had little cups of juice and water set out for them to do that. And then they were supposed to put the bag back in a different place instead of being on the table. And then at the end of everybody going through, if the table was empty, then everybody took their meds. But in truth, if that is the system and you don't have somebody there who's really monitoring that really carefully, anybody could have taken one of those bags and put it into the other bin that indicated that they'd already taken it. The kid could take their own bag, not take their medicine, and put it into that bin. And so you don't really have very tight control. So if you're moving all of your medicines, you need to make sure that someone can physically monitor where they all are at every moment in time and verify that actually that pill went in that mouth and then there was some swallowing activity when the cup got picked up. And it was only after that happened that the bag got returned to the bin to go back to the health center. So you can really, with confidence, sign off on your administration record that that medication was given. And again, that will be different depending upon how many kids you have who are taking meds and how many nursing staff you have. And in some cases, that ratio makes it really easy that there's only a few kids coming for meds and you got plenty of people to watch over that. But the higher the ratio of kids with medicines to nurses you have, the more carefully you need to control that process to make sure that it's going to be working appropriately. And then in terms of the medication administration record keeping, if you have adequate internet service to use an online medication management system, that makes retrieving those records much easier and it makes it a much quicker process in the moment. But again, that gets complicated one more step if you're giving the medicines in a different place than where your computer in the health center is located. So you need to think about that as well. There are other issues that are both directly and indirectly related to medication management that have to do with what level of medical support are you able to provide and willing to provide at your camp. And since we have kids who often are quite ill and we want to make our camping programs available to kids who are on treatment and who are potentially at risk for having serious side effects of their chemotherapy while they're in the camp setting, you want to know what you're going to do in that kind of a situation. And obviously, if you're in a really remote place and you don't have easy access to EMS and it's going to take you 3 hours to drive the kid back to the treatment center, then you need to look at it from a different perspective and define what population is appropriate to go to camp a little bit differently. But there's some camps where EMS is quickly, maybe 5 to 10 minutes, an ambulance can be there, and there's a hospital with a well-equipped ER that understands cancer and kids. You need to think about that accessibility also for offsite programs. If you're sending kids to go on a river rafting trip during the week, or on maybe an overnight backpacking or some other offsite program that they go to, then they're going to be in a different place, and you need to take into account how they might access emergency services at that site as well. Do you have a problem if you've got a kid who becomes neutropenic and febrile and is looking a little bit sketchy? You're not necessarily going to be comfortable just calling EMS and sending them to the local emergency room. If they don't see many kids and they're not used to oncology, and you've got somebody who might be in impending septic shock from febrile neutropenic infection, then you're going to think about how quickly can you get that child to an oncology treatment center, and what things can you do in the meantime to make sure that they're going to be in good shape when they get there. So can you monitor vital signs, including oxygen saturation? Can you give IV fluids? Can you draw blood cultures and lab work and then give antibiotics and send the labs off or with the kid in the helicopter that's going back to your home-based treatment center? There are some camps that actually have intensivists on site, and they have resuscitation meds and ET tubes and things like that. And so they feel very comfortable that they can stabilize somebody for a significant period of time while they're waiting for somebody to come. But you need to be careful if you have the ET tubes and the resuscitation medications there and you don't have a person qualified to use them, because if you've got them, then the expectation is that they're going to be available to your campers. And if the only doctor there is your oncologist who hasn't intubated anybody for 25 years, that's probably not a really good situation to have them trying to manage a potentially shocky febrile neutropenic patient. So you should define what level of support you're comfortable providing based upon who those providers are going to be, as well as what your physical location is. And then other sort of logistical things to think about while you're looking for a way to secure the medications, you also don't want to impede accessibility for the people who need them, especially when there are a lot of PRN meds. if everything is locked up tightly in some place that's a long way away, and the person who has the key is on a hiking trip with, the Blue Spruce group, then that's not going to work very well. Refrigerating of medications sometimes is an issue, and they need to be lockable and accessible. And in some camps, that's a very easy thing to accomplish. And in other camps, not so much. If you've got one refrigerator in the health center, and that's where all of the staff, including 2/3 of the camp administrative staff, keep their lunch, then that's not really a good place for you to keep medications. And if you've got a refrigerator that is available only for medications and that can be locked, but it's in a place that is going to be locked up and empty and unattended for significant periods of time during the day, that's not going to work very well either. And if you're in a family camp circumstance where you've got adult parents who are supposed to be responsible for giving their kids meds, and they're keeping some of the medications with them in their cabin, and then there's one bottle of something that needs to be in the refrigerator, and we'll say, well, we'll just let you stick it in this refrigerator in the kitchen for now because we don't really have another place to keep it. That's not a very good solution to that problem either. So you need to try to find a solution that will maintain security, but also maintain accessibility. And sometimes, buying a little under-the-counter refrigerator that you didn't have before can make a world of difference in making that something that is realistic for you to do. And speaking of accessibility, I've been focusing mostly on how you're managing the medications for the kids who are not able to be in control of their own meds because of their age, but you have also staff people who are on site who may have medications, and you need to be able to manage that need as well. And there's a variety of things that are different for how you manage staff meds as compared to how you manage the camper meds if they are minors, but still control and easy access are major themes that you need to keep in mind. The whole process of managing the medications starts from the moment that you take them from the family. And that is going to be something that's going to be different depending on how your camp works as well. If all of your kids are driven to camp by their parents, then you've got the parent right there. You can take them directly from them. You can get the parent's description of how they should be used. If there's any discrepancies with what it says on the bottle, you can ask them about that right at the moment. But if your kids all arrive on a bus, then somebody else, somewhere else, is going to be the one that's interacting directly with the parent and collecting all the medications, and probably not going to be asking the same level of detail in terms of the questions that they can ask the parent about discrepancies and things like that, because they're going to be in a hurry and it might not be a medically trained person. So you need to have a system then to make sure that you've got access to go back and ask the parents if you need clarification on things, and also potentially to get in touch with the prescribing doctor at the oncology treatment center if what the directions on the bottle say are different from what the parent said, which is right, and in some cases neither of them is right. With things like 6-MP, the dose changes from time to time as counts go up and down. There's a lot of other medications that the prescription might last longer than the specific direction of how you give it and how much you give and when you give it. So all of those things need to be very carefully checked when the kids first arrive, but how you do that depends a lot on how the kids are arriving and who's available for you to ask questions of at that time. You should always have a way of double checking with the provider if something just doesn't seem right, as well as with the parents, to make sure, because sometimes parents are confused if they just went to the clinic and the dose was changed and they have a new bottle, but they forgot that the doctor said, oh, you're going to start taking it in a different way, then they may be quite certain that this is the way they've been given it, but they just misunderstood the instructions. So it's always good to get both sides of the story if everything doesn't match up. If everything matches up perfectly, those are the easy ones and you don't need to worry so much about that. Staff meds are different. The staff are going to bring their own medications and then hand them to you at some point, but you don't have the same responsibility, obviously, with the adult staff that you do with the campers, and you also don't have the same right to know what it is that they are taking. So for them, you need to devise a system where they can give you their medications so that you can keep anybody else from getting into them, but where they can go in and out and get them without you necessarily knowing what it is that they're taking. And so some kind of separate place where the staff meds can be kept in some kind of a container that has their name labeled on it, so you can make sure that a staff person isn't taking someone else's medicines, but in a situation where it doesn't necessarily allow you to see what they are taking if they don't want you to. Obviously, if they don't care, then they're free to share that information with you. But the only thing that you're really allowed to ask most of the time of a staff member is if they're taking medications that would impact their job performance, because that would have an impact, obviously, on whether that was something that was appropriate for them to be taken while they were at camp as a volunteer or employed staff member. Sometimes we have staff members in our oncology camps who are graduate patients, and sometimes they're still on therapy. If they were diagnosed as older adolescents, they might be a camp staff member when they're still on their cancer treatment. Do we let those people come to camp as staff? Are we worried that they might get into trouble because of their cancer and that their medical needs will take them away from their staff responsibilities? If that's the case, that's okay, as long as you plan for it and make sure that there's enough staff around. But you need to think about that issue before it presents itself as a sudden problem when one of your staff members comes in with a febrile neutropenia. The other question is what role the camp staff are going to have in administration of medications to the campers and to any other staff. As long as you've thought through and devised a system that is consistent with the regulatory framework that you're working in, then those things can all work. And then one other thing is that most of our camps have sort of these stock medication bottles that are on a shelf somewhere, so that if somebody drops something or loses something or throws it up or forgets it, that we can provide the common kinds of things that we think they're going to be bringing. And that sometimes includes things like 6-MP or methotrexate pills, but often Bactrim, Septra, things that a lot of the kids are going to be on, anti-nausea drugs, different kinds of things that are sort of common things that kids with cancer are getting can be kept on your shelf as stock meds if you've got appropriate instructions by a licensed provider for how you're going to use those. We talked already about the dining hall versus going to the health center. Unusual timing is another thing that you need to worry about. So we love to give all the medicines at mealtime, but sometimes something has to be given at 3 p.m. or it might have to be given just before bed, or it might have to be given just after you get up before breakfast when you haven't had anything to eat yet. And so you need to think about how you're going to accomplish those things. Who's going to do it? Somebody has to have the responsibility to remember to make sure that it gets done. Maybe the nurse is going to go to the living unit where the kids are, or go to the activity that the kid is in at 3 o'clock in the afternoon. Maybe you're going to ask those counselors, you know, this kid needs a medication every day at 3 p.m. wherever he is, whatever activity he's in, please make sure he gets here. Sometimes that doesn't happen. So the other thing that you need to think about is, what do you do? What's your system for dealing with the campers who don't show up when they're supposed to come to get their meds? And is that different if it's something that's a nighttime med as compared to something in the daytime? Is it harder for you to get staff in the middle of the night to go over and wake up a counselor and a camper than it is to go out to the arts and crafts building at 3 in the afternoon? And then there always are going to be those either remote site or out of camp trips that some of the campers are going to be on. And how are you going to staff that, and who's going to give that? And sometimes it can be a counselor or another staff member. Sometimes a medical staff person will have to accompany that trip, depending on what the medicine is and what the situation is. We talked a little bit already about how things are different in family camp situations or with all adult programs. It can be similar to what you would do with adult staff. except that in adult programs for our population, there may be kids who are distinctly impaired and need to have an adult be actually responsible for their health care. And what, if you have family camp and say, well, the parents are going to keep and administer all the medications themselves, what does keep mean? Does that mean they have to be carrying it around with them all the time? Can they leave it in their cabin? If they leave it in their cabin, is there anybody else who also lives in that cabin? Or is the cabin going to be locked or unlocked during the day? So you need to make sure that something is not ever going to be out and about somewhere where someone else could have access to it. It needs to be controlled in some sense, even if there are adults who are making the decision. Well, I decided I left it there because that would be okay, and I'm in charge because I'm the parent. That may work when they're at home, but that won't work when they're at camp. And I think we talked about the accreditation standards and why those are important. So I just wanted to go through a few of the very common ones really quickly. We talked about the difference between the term drug and medication. ACA uses the word drug, but really it's medications that we're dealing with at camp. A drug that is not a medication is something like heroin that has no medical use and shouldn't be at your camp. So you shouldn't need to worry about that. But like I said, every medication is a drug. So that is a word that works in that context, but just keep in mind the difference between that. And some health supplements are not either drugs or medications, but just stuff that somebody decided for whatever reason they thought would be good for them to take. And so you just need to think about what those are and how you're going to deal with them. So you need to know what it is that you're including in your policy. You have to have a record of all of the medicines, both prescribed and OTC, for each camper. You have to have signed permission to provide healthcare services, the permission to treat form. And an alternative would be a waiver refusing permission to treat, but that wouldn't really work in our population. And then the health screening that I talked about that includes verifying all of the information, updating doses and administration directions and things like that has to occur within 24 hours of when the kids arrive at camp. You have to have a comprehensive set of healthcare policies and procedures with look at your sort of global healthcare delivery system, and it needs to be reviewed at least every 3 years by a licensed healthcare professional. It defines sort of what are the responsibilities and authority of the different people in your system, who's working in what situation and who has what authority. And it also defines access to additional medical or mental health services that you might need under different circumstances during the time that you're on site at camp. Talks about those policies for dealing with common camp healthcare situations. You need to tell the staff information that they need to help take care of their campers, but you shouldn't tell them more than they need because that violates HIPAA guidelines. What equipment and supplies you have, where they are, how to access them and use them, and training for any staff that are going to be directly involved in providing medical care. Storing all medications under lock and key unless they're in the controlled possession of the person who responds and to administer them. That doesn't mean they're in my cabin, which is unlocked. And that prescription drugs are only given under the specific directions of a licensed prescriber. Can be a doctor, can be a nurse, sometimes can be a pharmacist. The non-prescription drugs, we talked about having the treatment procedures, and then having things like EpiPens or inhalers around is an exception that's allowed. Record keeping we talked about. And so all of those important systems that are defined by the ACA guidelines are also defined in the COCA Gold Ribbon standards and are also included in many insurance company policy guidelines and in some of the states that have a more comprehensive set of organized camping standards. They all are pretty much exactly the same. So once you get familiar with those, it becomes pretty much second nature to be aware of those. So I've done a lot of talking, haven't seen a lot of activity, but would love to have any of you who have stories or questions or comments. This would be a wonderful time to share those.
I have a quick question about when you said delegating another staff member to give meds, whether it's like during the day or in the evening. Do you we at our camp we have a policy for delegating who can give meds, but I think a lot of that also has to do with your state's what's the word, guidelines from your nursing regulatory committee, that like ours for Delaware says that you can only delegate to someone who is licensed to give meds. Other places, you can have a policy that shows that you've instructed them and they sign that they have shown you that they understand how to do it.
Right, and I'm not familiar with what exactly how the laws are written everywhere, but in most places, even if your general healthcare regulations define that medications can only be dispensed by certain licensed health professionals, that clearly that's not true if you give a prescription to a parent. And so you have an in loco parentis role as a camp staff member. And in most jurisdictions, if the medical staff have documented that they've trained the counseling staff to do a very specific thing, like give this pill at this time, that's usually acceptable, even when your healthcare laws say medicines can only be administered by a licensed healthcare provider and define the types of nurse. And I'm sure there would be people in the local jurisdiction who would be familiar with the specific legal context wherever you are located. But usually that's something that you can do even in those places where there are more restrictive definitions of who can dispense medicine from the professional perspective.
Thank you. Good to know.
I think the bottom line message from my perspective is that there's a lot of things to think about when you're putting together your medication management program. But what you need to find is what works for you. And so don't try to copy exactly how somebody else does it. As long as you're aware of the regulatory constraints, try to find something that works best in your environment, and that's what's going to serve you best in the long term. And so finding those areas where, like if you can find an exception to the prescriptive regulations that allows you to have a couple of extra EpiPens sitting on a shelf somewhere in case somebody gets stung by a bee who didn't bring their own, or things like that, are often the kinds of things that can really make a huge difference in how easy it is to provide the care that you need to provide.
I have a quick question, I think. I'm trying to formulate it here. I have a bit of a problem with the staff medications, in the fact that I do several camps. One of them is a non-oncology camp, and I talk to everybody. I kind of feel like, as the medical person or the medical lead, I kind of need to know what they're on in case there's an injury and what their schedule is, or if they weren't able to answer for themselves. If they were knocked on. I work at a sports camp. But also at Camp Tecumseh or whatever other camper it is, I still think it needs to be known what they're on in case there's a problem, to keep them safe. And I think it has to be part of the agreement to come on employment, that you don't have to divulge everything to everybody. And of course, HIPAA comes into mind, but somebody has to know that you're at least taking a medication. I'm thinking of a couple of different things here, so I'm not formulating it very well. But I always, with my staff that at my other camp, I have a one-on-one with everybody, and tell them, you don't have to tell me, I need to know, but I would prefer if you tell me what you're on, because we're together for basically 10 weeks of the summer, and I really need to know if there's something that's going on. And you know what I'm trying to say?
No, absolutely. And as a doctor who's been in that situation, I feel exactly the same way. And if you can convince them to volunteer that information to you, that's great. But the because of the law, and in part it's the ADA, that people don't have to disclose disabilities if they don't impact the work environment. They're not required to tell you that. So the employer cannot ask that question. You could ask it while you're at camp. Say, have a meeting with the staff. I'm going to be the camp doc here. I'm going to be, taking care of the campers and available for things that might come up with you as well. It would really be helpful for me to know if you're taking any kind of medication, so that if something happens, I'll have that as my background, and it'll help me to decide what the best approach is to providing appropriate care for you. And if they're willing to tell you under that circumstance, that's fine. But the camp officially is not allowed to ask those questions the way the law is written, except to say, are you taking anything that could impact your ability to do your job? That's the way the OSHA laws and the ADA laws are written. So I am very sympathetic to the point. And most of the time, especially in the context of oncology camps, where most of our staff, or at least many of them, have been campers in the program before, and there are a lot of long-term volunteers who've been part of the family for a long time. Usually most of those people are going to be perfectly willing to share that information with you, but it has to be their choice.
So, Dr. Mike,
I go back and forth on that too. I do think the people that are new are more willing to, divulge more information because they're so excited to be there, and they're like, yeah, there's no problem. I think as life goes on, I think people are fearful that if people find out that they're on a cardiac med or a psych med or something, they may feel like that's an impact on their job, or so, or to be allowed to come to the camp. And again, I'm coming at it from more of a for-profit camp and not an oncology camp. So there's a bunch of things going on in my head that I've been doing for 5 or 6 years now. I also had to, it was really funny this year, I had to rewrite all of the protocols, and there was a new doctor that came in from anaphylaxis down to a headache to stomach aches and everything like that. And again, my brain's a little fried right now, but they required us to get a book. And I think it was, and I can't, this is how bad I am lately, but it was, I think, how you do telephone calls. I forget the name of the book, but if somebody called in, this is the gold standard book that they use. Excuse me, that's the phone. And that went a long way to alleviating a lot of their fears. If I had that book in my office and used that as protocols, they were like, okay, we're okay for that for the most part. I'll have to look up the name of the book.
But I think somebody's trying to give us the signal that we're running out of time. But I'm very sympathetic to that point, and we just need to work within the confines of what we're allowed to do by the law. But the individual staff members can tell you whatever they want. They're just not allowed to ask questions. And
one of our programs we had was golfing, and I had one kid that had a 3 o'clock appointment at the 3 o'clock medication at the golf course. Fortunately, I was able to have a very responsible counselor that I had to delegate. And I had told his mom, I cleared everything with the parents and said, if he's going to golf, somebody else might have to give him his medication, but I only sent one pill. So if there was a problem, they had to call me and I had to go to the golf course type of thing. So it was all good. Thank you. I think we're on time here.
Thank you, Dr. Mike. Thank you, everybody, for participating. I hope we'll see y'all at the Best of COCA Awards at 8 p.m. Eastern tonight.
Yes, I've noticed during this conference that the lobbies and the hallways are much quieter than they usually are at a COCA conference. Hope to see you later on.
Thanks, Dr. Mike.
thank you, Mike.
Bye-bye. Hey, Brandon.
Thank you.